It's time to broadcast to our patients the use it or lose it message regarding their insurance. Uh, we know how dental insurance works because we live this stuff every day, but the average dental consumer doesn't really think about the fact that they have dental benefits, and if they don't use them, they lose them. When we bring it up to them, they think, of course, that's how it works, but I wasn't thinking about it. Let me prove how the average dental consumer doesn't even think about this, Naren. And I'm going to prove this by sharing a statistic with you. Naren, do you know that less than 20% of people that have dental insurance benefits fully use their insurance benefits every year? Less than 20%. That
I'm
means
not
that four out
surprised,
of five,
Gary.
yeah, 4 out of 5 people that have dental insurance benefits
Don't use it.
don't use it. Um, and just out of sight, out of mind. And when we
I think
tell,
I'm one of them, Gary. I'm sure I don't use my
I know that,
benefits.
Aaron. I know some great dentists in Mississauga. We can change that for you. You ought to use those benefits because if patients have a need or a want, we can help them fully utilize their benefits. So I like the messaging: use it or lose it. So we can send your patients an end of the year insurance letter and say, although treatment's never dictated by insurance, um, we love to help our patients that have a need or have an interest get it taken care of while they have dental insurance benefits. If you have a concern or something you'd like to get taken care of, it might be useful to schedule an appointment before the end of the year so we can help you fully utilize your insurance benefits. So we can send a letter. I like doing that in email format today. We might send some of those letters in snail mail format if we know our patients would be more likely to read a physical, post-delivered letter. Some might go by snail mail. But the very best way to do that is face to face with our patient, especially when we can talk specifically to them. Um, and so we can identify people that have unscheduled treatment and also have insurance benefits left, and we can have a very specific message for them. So, Naren, if you were my patient and I was your hygienist, I might say something like this. Um, Naren, I noticed that doctors recommended some fillings on the upper left to replace those old fillings you have that are failing there. And I see they haven't been completed yet. And I'm concerned about that because if we wait till it hurts, Naren, those fillings, we might not be able to replace with fillings. It might be something more complex like a root canal and crown. And we'd like to take care of it as conservatively as we can. I'm going to ask doctor to take a look at that area when she comes in today to do the hygiene exam. So now I've used persuasion to let the patient know that we have this need. And then I might add, say, and by the way, if doctor does recommend treatment, we might want to get it done before the end of the year to help you utilize those insurance benefits that you have. Because when the clock strikes midnight, December 31st, any unused benefits don't carry over to you for the next year. They don't carry over, but they go back to the fat cats at the insurance company. That's actually the exact language I like to use, Naren. They go back to the fat cats at the insurance company. And we don't need to line their pockets anymore. They're already lining their pockets enough. We don't need to line their pockets anymore. I love using that messaging. Yeah, it's caustic, but it needs to be. Patients need to understand the insurance company's not on their side. So I like that languaging. Now let me piggyback it onto the next recommendation. So recommendation number one is it's time to get that use it or lose it messaging out in every format. Send an email, send a snail mail post letter for those that would be more likely to appreciate it in that format. And then let's make a point of talking to our patients face to face about this. By the way, your insurance coordinator can lend an assist. Your insurance coordinator can prepare for this for your morning huddle. The insurance coordinator can have a list of patients on your schedule today. They could be on the restorative side, but they're more likely to be on the hygiene side. These would be people that were on the schedule today that have unscheduled treatment and benefits available. So we can identify that in the morning huddle so we can make sure we identify patients we want to have that conversation for.